why do we teach? Why are we teaching patients? As you know, RNs are the ones who do the initial teaching with our patients, right? LPNs, they reinforce it, okay? So it helps with why are we teaching, right? So it's going to help with patients complying to their treatment plan, okay? To make sure they're taking their meds as they should, make sure they're watching out for things that could compromise or worsen their disease process. And it's going to improve safety considerations that could occur. Okay, so disease management, preventing recurrence with potential complications, as I'm saying, and it does also prevent hospital readmissions. Although some of our patients are freaking flyers, patients can be forgetful with care, and they will also need reminding. So for me, we always do teaching in every single of our visits, and I also do teaching with the methadone clinic, and we also have to tell patients, hey, when you, especially with induction patients, when you're taking the methadone, you let us know when the symptoms stop completely. So that way we need to decide whether you can go up or you need to stay where you are, because we're trying to make sure patients at their baseline. So patients can be forgetful with care, so they do need reminding, right? They will need to understand how to stay safe. So safety is a big key in healthcare, which is why we want to prevent recurring hospitalizations from happening. They need to remember how to properly be cared for during their disease process. So with diabetes, you have to remind them you should be eating these foods, certain amount of foods or snacks, rather than having the sweet carb heavy meals that could elevate your blood glucose level. And then they will need to know when to seek emergency care, because we're not always there in our homes and we can't see what they're supposed to do. So basically, all nurses, whether you're an RN, whether you're an LPN, we play a role in the continuity of care for patients. So which is why teaching should be done every single moment you see these patients, whether it's through home care, whether it's through a methadone clinic, or I don't know, a hospital, nursing home, whatever type of nursing you're doing, it's always important to teach. Anyways, have a wonderful day and have a good rest of your week. Bye.